What is going on, guys? Welcome to the video. Before we get started today, I just quickly want to remind you that I am not a doctor and I'm not going to be giving any medical advice inside the video. All I'm doing here is speaking to you from my personal experience. And in case you're new to the channel, I have been injecting testosterone for about the last 6 months. It's prescribed to me from a doctor, and I'm not doing this because I want to become the next Jay Cutler and step on stage on Mr. Olympia and win the gold medal of bodybuilding. I'm just doing this to optimize my testosterone levels and get them in the high end of the normal range. All right, so today I want to talk to y'all about what has probably been the most requested topic, and that is, what side effects have I noticed since getting started on test? One definite side effect has been now when I go out for breakfast tacos, I get 4 tacos instead of just 3 tacos. Actually, I've always got 4 tacos. I do actually think that it has increased my appetite a lot. It's been a lot easier for me to put on weight during this bulk than previous bulks. Like, I weigh almost 200 pounds now, and before test, the most I ever weighed was probably 187. Now, I think something that most people are curious about is how has it impacted my sex drive? And to be honest with y'all, this is not one of the reasons I got on TRT. Like, I've never really had an issue with this. But that being said, the difference I've noticed is that in the past, I'd have sex, and then for the rest of the day, my sex drive would be significantly diminished. Like, it would not come back full force until the next morning. But now I'll have sex, and then like 30 minutes or an hour or 2 later, that shit comes back pretty much 100%. And I've noticed a very similar benefit with my overall energy levels. I'm 30 years old now, and over the last few years, I've realized that if I don't get 8 or 9 hours of sleep every single night, then I feel kind of groggy and lazy the next day. But now, I still aim for those 9 hours a night, don't get me wrong, but if I happen to get 6 or 7 hours one night, I still wake up feeling super energized. And this makes sense because if you're fully natural, then the most important factor for maintaining high test levels is getting a lot of sleep every night. And now that I'm getting my testosterone from an outside source, obviously sleep is not going to be quite as important.
I've been all in my bag. You been all in my business. You be all in your feelings. I've been all in them trenches. I've been all in my bag. You be all in my business. Know they notice me flexing. Fit in all of my fitness.
Bro, there was a shit ton of comments in the last testosterone video I did asking how I found my doctor, because I mentioned that at first I went to a local men's clinic and it was a nightmare. Like, I knew more than the doctors did. They wanted to prescribe me things I didn't really need, and they said that I would have to physically go to their office every week to get the injection. Anyway, after a bunch of searching, I finally found a telemedicine clinic, which basically means that they can treat patients from across the United States over the telephone. And from the first talk I had with them, it was obvious that they specialize in hormone replacement therapy. They knew so much more than I did, and it was just a big relief. All I had to do was go to a local laboratory to get my blood work done, and then I just had to do a phone call with one of the doctors to go over the blood work and figure out my protocol. And now they just send me my medication in a little box like this right to my doorstep, and it's been crazy convenient. The name of the clinic is Peter Uncaged MD. They actually only charged me $99 a month for all my medication, which is less than half the clinic here was charging me. And because so many of y'all were asking about it, I talked to them and I was able to create a little referral code. So if you click the first link in the description, you use that code, you're actually gonna get 50% off your initial labs. And I just want to be very clear here. I'm not saying that all of you should rush over and try and get your testosterone. But if you're someone who's been struggling with local doctors like I did, or you've been experiencing low T symptoms like sexual dysfunction or extreme fatigue, then it doesn't hurt to get your blood work done and get a consultation with a doctor who knows their shit. I like big bustin', I cannot lie. You other brothers can't deny. When that pre-workout kicks in, I get sprung. I also just passed the gym because I was singing too hard. So today I'm not going to talk a lot about strength gains or muscle gains because in my opinion those are not side effects, those are like the intended effects. But in case you missed my 3-month update video, I'll link that in the description. In that video I went in depth talking about the different gains I'd seen, and just to give y'all an update, since then, so from month 4 to month 6, the gains have definitely continued, but the rate of gains has slowed down a little bit. And I think that's because my body has started to adapt to this new level of testosterone. So I can't come into the gym every week and just throw 5 more pounds on the bench and the squat. And because of that, what I've been doing is changing up my rep ranges. So today, instead of doing 5 reps, I'm working with 225 pounds, a lot more comfortable weight, and I'm working for 4 sets of 10 reps. And I think that's gonna help me break through this plateau and keep the gains coming. Bro, if you've never tried bent over rows like that with dumbbells instead of a barbell, highly recommend it. I feel it a lot more on my lats and my upper back than if I'm doing a barbell row.
Yeah, he sets my body in motion. He knows how to turn things up. And he knows what gets me going. Yeah, like a little text saying, hey, what's up? They look at me, I'm in a bad situation. Look at him, he's got a bad reputation. They be looking at us, thinking we are too much. Look at me, I'm in a bad situation. Look at him, he's got a bad reputation. They be looking at us.
So real quick, let me show y'all what I'm looking like with the pump going right now. I'm weighing, like I said, about 197, which is, it's the heaviest I've ever been. So the fact that I still have some decent ab definition, it's super encouraging. I think my plan is probably to bulk up until like 205 pounds or so and see how I'm looking there, but that'll probably be time to cut after that. Anyway, bring it in and let's talk about another side effect, which has been hair growth. So if we look at my beard, this is definitely a lot more full than it was before TRT. It's grown in a lot more nicely, but it's also growing a lot faster. And the same thing is true for the hair on my chest, my abs, down, you know where. Bring that camera back up here. And personally, for me, this is a downside. Like, I do like having the full beard, but I used to be able to manscape once like every other week and I'd still look pretty groomed, but now I basically have to manscape twice a week in order to keep myself looking fresh. It's just a big time investment. So talking about hair, another big side effect to talk about is hair loss, like on your head. And this is something that pretty much every dude who gets to be my age, about 30, starts to worry about. But if you're on testosterone or any anabolic, the harsh fact is that your body is going to convert some of that testosterone to DHT, and this is something that is responsible for a lot of different important functions in your body, but one of them, unfortunately, is that it can accelerate male pattern baldness. So if you're someone who's genetically predisposed to male pattern baldness and to getting a receding hairline, it can make that happen a little bit more quickly. For me personally, I'm always someone who's had like a bigger forehead my whole life and a kind of higher hairline, and I definitely have not noticed any change in that over the last 6 months. I'm hoping that it stays that way, but I am going to get my DHT levels tested on my next labs just to see where they're at. And once I get those new lab results in, I'll definitely film an update video for y'all to let you know where all my different levels are sitting at. And my doctor also recently made some changes to my protocol and my dosages, so I'll make sure to fill you in on that too.
My chain dancing, my head big, my top heavy, I let it down. See me shining, they hating on me, they mean mugging, I let them down. She call me Poppy, I'm popping now.
Y'all are always giving me shit for not knowing how to cook, but I just cooked us up this little Italian rigatoni with meat sauce.
Oh yeah, did you?
I did, I'm a chef.
No, he didn't. He's been out filming. I just cooked all this.
Yeah, luckily Julia knows how to cook because, oh
Guys,
man!
what the?
We're watching the Patriots-Houston game, and the Patriots are down 14-3 right now. Luckily for us, the Patriots are just like far and away the best team in the NFL for the last 15 years.
Wait, how many rings?
I lost count.
Brady, come on. You know he's the bet.
The bet?
The best. The GOAT.
The GOAT. The bet goat. Damn, baby, it's like a 10 out of 10. This is the bet right here. It looks like we might actually lose this game. We just don't have an offensive line this year. Let me tell you about a little side effect that I did not expect. So over the last couple years, I've had a bad wrist on my right side. It just felt like it was one of those lingering things with a ligament or something that whenever I would do curls with a supinated grip or a few other movements, it would just get worse again and then it would never heal. And then kind of magically, after being on test for like 1 or 2 months, it healed up and I can do curls again and pretty much anything with it with no pain. And I don't really understand how the testosterone would have done that, but there's nothing else I changed. Pretty much the only other side effect that I can think of is at first I did get a little bit of acne breakout, but this is when I was going to that shitty local clinic and they were giving me 1 injection per week of 200 milligrams, which is a lot of testosterone for 1 injection. Ever since I switched clinics and I've been doing a lot smaller injections, it hasn't been an issue. So to sum this video up, I've had pretty few negative side effects, though to be honest, I'm more worried about like long-term side effects because TRT is still a relative new medicine and there's not that many long-term studies done. The only other thing I want to be real clear about is that I made this decision when I was 29, just before I turned 30, and I really think this is the earliest possible age to even consider it, and admittedly it's still a pretty young age to do it. You know, it's not a decision to be taken lightly because once you get on test, the expectation is that you're going to stay on it for the rest of your life because it does shut down your natural test production. And yes, there are ways to try and reboot that, but it's never a guarantee. Anyway, that all being said, I'm going to wrap this video up right here. If you made it to the ends, I appreciate you, bro. Give it a thumbs up. If you're new to the channel, click subscribe and turn notifications on because I drop 2 new videos every single week and they are all dope as hell. I will talk to all of y'all in the next video. Stay beastly.